Medical miracle, the first child in the world was born after a uterus transplant from a deceased donor. This material is from June 15, 2023, on the pages of my live journal. Following the theme that I periodically highlight in my blog, including very recently, uterus transplantation. So, for the first time in the world, a Brazilian woman who received a uterus transplant from a deceased donor has successfully given birth to a girl, according to a case report published in The Lancet. The report shows that uterus transplants from deceased donors are feasible and can provide access for all women with uterine infertility, eliminating the need for living donors. Currently, uterus donation is only available to women whose family members are willing to become donors. The use of deceased donors could significantly expand access to this treatment, and our results support the concept of a new treatment option for women with uterine infertility, said Danny Eisenberg from the University of São Paulo in Brazil, who led the research. The recipient of the transplant was a patient with uterine infertility. This was the first uterus transplant in Latin America. Background in brief: previously, attempts at uterus transplants from deceased donors had been made in the USA, the Czech Republic, and Turkey and 10 other countries, but this is the first that resulted in a live birth. The first births following uterus transplants from living donors occurred in Sweden in September 2013. In total, 39 such procedures had been performed previously, resulting in 11 live births to date. The first uterus transplant surgeries from living donors marked an important medical milestone, creating the possibility of childbirth for many infertile women with access to suitable donors and the necessary medical facilities. However, the need for a living donor poses a significant limitation, as donors are rarely found and are usually voluntary, suitable family members or close friends. The number of people willing and committed to donating organs after their own death is much larger than that of living donors, providing a much broader pool of potential donors. Some technical details of what happened this time. The uterus transplant surgery took place in September 2016. The recipient of the uterus was a 32-year-old woman who was born without a uterus due to Mayer-Rokitansky-Kuster-Hauser, MRKH, syndrome. 4 months prior to the transplant, she underwent one cycle of in vitro fertilization, IVF, resulting in 8 fertilized eggs that were cryopreserved. The woman who became the uterus donor was 45 years old and died from a subarachnoid hemorrhage, a type of stroke accompanied by bleeding on the surface of the brain. The uterus was removed from the donor and then transplanted to the recipient in a surgery that lasted 10.5 hours. The operation involved connecting the veins and arteries of the donor uterus to those of the recipient, as well as the ligaments. After the surgery, the recipient spent 2 days in intensive care and then 6 days in a specialized transplantation unit. While in the hospital, she received 5 immunosuppressive medications, as well as antimicrobial drugs, anticoagulants, and aspirin. Immunosuppression continued beyond the hospital stay until delivery. 5 months after the transplant, the uterus showed no signs of rejection, ultrasound scans revealed no abnormalities, and the recipient had regular menstruation. Fertilized eggs were implanted 7 months later. Doctors were able to implant the fertilized eggs into the transplanted uterus much earlier than in previous uterus transplant operations, where this typically occurred after a year. 10 days after implantation, it was confirmed that the recipient was pregnant. At week 10, a non-invasive prenatal test was conducted, which showed a normal fetus, and ultrasounds at weeks 12 and 20 did not reveal any developmental abnormalities in the fetus. During the pregnancy, the recipient had no issues other than a kidney infection at week 32, which was treated with antibiotics in the hospital. A girl was born via caesarean section at 35 weeks and 3 days. The transplanted uterus was removed during the caesarean section and showed no abnormalities. Both the recipient and the child were discharged 3 days after birth, and the early observation was uneventful. Preliminary conclusions: in the context of a shortage of living donors, the new technique may help increase availability and provide more women with the opportunity to conceive. However, the results and effects of donations from living and deceased donors still need to be compared, and doctors caution that surgical methods and immunosuppression techniques require further optimization in the future. The photograph from the public domain on the internet is illustrative and has almost no relation to the events described below.